It is 2:30 on Friday in January of an odd-numbered year. AARP, All Things Advocacy. Josh Askvig, State Director of AARP. Janelle Most, our Advocacy Director. Happy Friday.
Yes, it is Friday. It's been a long but a good week.
The legislature has certainly started picking up speed. I think when we talked last week, we were talking about how it was a little bit slower. Doesn't seem to be quite that slow anymore.
No, it definitely has picked up pace this week, and I anticipate the next 2 weeks for sure are going to be very busy.
Yeah, the next 2 weeks are going to be very busy, and we're going to get to that more in a little bit. But let's just talk a little bit about this week maybe and what happened this week. We already have delved into a couple of our priority issues this week as part of it. And one of just as a quick reminder for all of us, first of all, if you haven't liked this event, go ahead and click the little thumbs up button for us. That'd be great. Let us know you're watching. Give us some feedback. You can also subscribe to the AARP North Dakota YouTube page. Go ahead and do that. That way you'll get alerts on when we're coming on, when we do these things. If there are any special All Things Advocacy presentations or other live YouTube streams, as well as the many events that we live stream to YouTube, you'll get alerts for those things as well. But just a quick reminder for folks, our 4 priorities this year: trying to lower the cost of prescription drugs, doing more to protect elders from financial exploitation and fraud and scams, trying to improve the ability to receive long-term care at home or enhancing home community-based services, and protecting pensions and retirement security for older adults, specifically in this instance for public employees. As part of it, 2 of those 3 issues, actually 3 of those 4 issues, it came up this week. Not necessarily, well, one will be a big focus. We'll talk about that in a second. But on the home and community-based services front, there was a tax bill that might help folks stay in their homes this week. You want to tell folks a little bit about that?
Yeah, and many of you might be familiar with the homestead tax credit, and there was a bill up in the House, actually in the Senate this week, that talked about expanding the eligibility for that homestead tax credit. So what that means is if you want to stay in your home, in your community longer, if you paid for your house, property taxes are starting to increase as the value of your house is increasing. This expands eligibility for other people to be eligible for that tax credit. And ultimately it means you can stay in your house longer.
Yeah, and it's a bill we worked on a number of sessions ago where we had championed the expansion of it for the first time since it was probably put in place in the 90s. And so this makes sense and something we weighed in on. And I know you did an excellent job pushing for that as well. In addition, let's jump to another issue, prescription drugs. We're going to talk a lot about that next week, but that actually came up this week already, and we weighed in on a bill related to prescription drug prices.
You know, it did, and it showed up in Senate Human Services, and one of the senators that introduced it talked about it as a bill that he would consider an old friend. Mm-hmm. So this isn't something that's come up before. It came up last legislative session. It's about insulin caps. What it does is cap insulin prices at $25. So it talks about the importance of, let's look at not just that particular drug, but our focus is really making all drugs more affordable. And so we did weigh in on this, saying, yes, this is an important step. We know that many folks can't afford their insulin, and this is a step forward. But we really want the legislature to look more broadly, look at how can we expand those protections, how can we make all medicine more affordable for people.
Yeah, and if I remember correctly, this is a $25 cap on out-of-pocket costs.
Correct.
For folks that use insulin or insulin products related to it. So last but certainly not least this week, public employee pensions was on the debate. I know I was there for a short period of time this morning and then had to leave to take care of some other business. I know you were there for the whole time this morning. Talk to folks a little bit about, first maybe explain what the bill that was talked about this morning does, and then maybe a little bit about what you heard this morning.
Sure. You know, anything about the legislature is often about endurance, and this morning was about endurance.
As an endurance athlete, I appreciate that reference.
It was almost a 4-hour hearing this morning, and what it does, the bill is, there's 2 different House bills that were studied during the interim. Mm-hmm. The retirement committee looked at how do we make right the public employee pension fund. We know that, there are a lot of people that rely on that. It's a stable, modest retirement system, retirement plan for folks. And so there's 2 separate bills, but ultimately they do the same thing. They're just a couple dates that are different. But what it does is really closes that defined benefit for folks in the public employee system, moves it to a defined contribution. Ultimately, what that means is there's options. It's going to cost more money. What we're concerned about, and what I've always concerned about today, is making sure that folks are retired right now and getting benefits right now still continue to have that, or people that are nearing retirement, as they make changes to make this, whole, how do we make sure those folks, their benefits that they've earned, continue to be there in the future?
Yeah, I think the other thing, and I know because you and I talked about this, that we also brought up today, or was at least in the submitted testimony, is the state of North Dakota could end up paying more for a lesser benefit. In that we just don't think that makes sense, especially at a time when they're struggling to find workforce and trying to recruit new employees and see that happen. I think the other thing that I know we talked about is the economic impact of pensions, especially in rural communities in North Dakota. That I think there's different research out there that shows for every dollar in a pension benefit paid out, that turns over $7 in a local community. And so, this isn't just about what the cost is in terms of the payment from the state on the front end, but it a lot of times helps keep people out of poverty, helps folks not use other social safety net programs because they have a stable income in retirement. And so appreciate, Janelle and I, for those of you watching, a little inside baseball, Janelle said to me before this session started, I'm not doing any of the pension bills, you're doing all of them. And I said, I promise you, I will do all of them. And then we found out the bill was being heard at the same time. We had a very important meeting that I could not get out of this morning. And so I just want to say thank you to Janelle. I know you did a wonderful job. And Janelle's saying, yeah, you've got the rest of them. You're on your own as part of this. But thank you, Janelle, for doing that, and appreciate it. So.
And he won't get off that easily, because there are several bills related to the Public Employee Pension Fund
Yes.
that are going to be considered this session. This is just the very beginning of this conversation. This will likely go to day 80. This is a very important discussion. I think people are committed, especially to making sure folks that are retired right now receive that, but they know they have to make some decisions about the future.
Yeah, absolutely. I think you're right. This is one of the issues that I think will keep the legislature here for probably, if not 80 days, close to it as part of it. So let's look ahead. So we looked a little bit back this week, a lot going on. And by the way, just for our viewers, that's just the stuff that we're giving you highlights on. There's our tracking list has grown immensely in the last 5 days. Tracking list being the number of bills we're watching, keeping track of, trying to make sure we understand if it's going to have an impact on 50 plus North Dakotans, what that impact would be as part of it. So there were a lot of other things we were working on too, but those are kind of the big ones that we thought were important. We're going to jump ahead to next week. Next week, we really get into the thick of it. Probably if not the top priority, one of the top priorities for us is prescription drug prices as part of it. And one of the bills that we shepherded through the interim committee is now going to get its first real hearing in the North Dakota legislative session. So you want to tell folks about that next week?
Yeah, so if you're sick of the high cost of medicine, which we know you are and many others are, Monday's your day. Senate Human Services will hear this bill that was studied during the interim. We'll have a lot of special guests there. Representative Lisa Meyer, who has really been shepherding this bill through the interim and working side by side with us and making sure that we can find ways to make medicine more affordable. She'll be there, but we also have Kathy Schwan, our state volunteer president, that will be there, speaking on behalf of all of you, saying this is important. It's time to make changes. We really want you to do that. So Monday morning, starting at 9 o'clock in the morning in Senate Human Services. If you have a red shirt, if you're in Bismarck, if you want to come and watch the hearing live, you're welcome to do that, or you can watch it on live. But we want people there. We want the Senate to know that this is an important bill, and it's time to really look forward. And really what it does is we've narrowed the focus. Senator Howard Anderson really helped us think this issue through last legislative session, and it passed in the Senate last session. We've narrowed the focus just to look at the 25 most costly drugs, again, in the PERS plan, comparing those prices to Canada. Ultimately, we want to make sure that folks, why should you pay any higher than other folks in countries that are near us? We really want to make medicine more affordable, and this is a step in the right direction.
Senate Bill 2031, Senate Human Services Committee, 9 a.m. on Monday. We will be there, as you heard. Volunteer State President Kathy Schwan will be there delivering testimony on behalf of AARP. I also know some of you who are probably watching this are planning to be in the room, and we're excited about that as well, and looking forward to that discussion. We do know that Big Pharma and some of their allies are going to push back pretty hard. And so if you haven't had a chance, certainly think about reaching out to your legislator, and we'll talk about that here more in a little bit as well. I just want to go into a little bit more depth on this on Senate Bill 2031 because it is such a priority for us. and I think it's important you spelled this out. This is a pilot project. The bill actually has a sunset clause. The bill draft actually has a sunset clause on it right now, so that it is something where we're going to test it out, see how it works. The original model bill was 250 drugs applied to all payers in the state, and it really looks at, why should we pay more than we know our neighbors to the north pay, which oftentimes can be a third of the price that we pay here as part of it. And so it's really looking at how do we set an upper payment limit on those costs of prescription drugs in North Dakota. So Monday, January 16th, I know it's Martin Luther King Day. And again, if you're in and around Bismarck and you want to come in and be a part of it, we invite you to come in and be a part of that as well. That's not all that's happening next week, though. It's going to be that's a big part of it, but that's not it. The issue of property taxes and homestead tax credit are coming back up again. And I think this is a good chance for you to talk a little bit about. So you talked about the homestead tax credit bill we talked about this week that was in on the Senate side. Why are we talking about the homestead tax credit again next week?
Well, what often happens is there's two different bills that will be introduced, maybe even more than two. So this is actually a bill that's going to start on the House side, and it's a little bit different than the one on the Senate side. But ultimately, what I think we're hearing from legislators is that they know that their constituents are really struggling to pay property taxes. They're struggling to stay in their home, and so they're finding different ways to have the conversation about what are steps that they can take. If it's tax credits, if it's property taxes, to really make homes more affordable. It's a priority of ours. We talk about, going out in communities, and one of the big things we hear from folks, I want to stay in my community. So we really push for how can you make housing more affordable. The legislature often considers several bills that look at those things, and that's what we're seeing is that you get conversations started in both chambers, and often then they meet in the middle and they'll find a bill that they can both agree to. So.
Yeah, absolutely. I just think it's helpful because sometimes people are like, well, wait, and we do that. Like, wait, for those of you, again, want a little inside baseball, sometimes we confuse ourselves about which one are you talking about and have to kind of step back and be like, hold on, I thought you were talking about this one. You're talking about this one as part of it. And it's the beauty of the legislative process and having a citizen legislature is everybody's got a little bit different idea and gets a chance to have it heard and talked about. Last but certainly not least, I don't want to ignore in a realm of trying to enhance supports for folks to stay safe and independent at home. A large chunk of that happens through the Department of Human Services. Actually, it's now the Department of Health and Human Services, although their budgets are still separate this session. But the Human Services Department budget, they're going to start going the Human Services budget on which chamber is that in? First of all,
it's in the Senate, and okay. So what they're going to start doing next week is really diving into the details of the budget. The Department of Human Services is a very large agency. There are many pieces to it. The things that are most important to us is really looking at the aging services budget. Mm-hmm. So again, making sure that folks can stay in their homes. So if you need food benefits, or if you need help with your utility costs, or if you're a caregiver and you need supports there. So those are the pieces of the budget they'll start digging into a little bit more deeper. And so we watch those pieces and we weigh in and make sure that, if there are increases, we can support those increases, or if we can, make sure that there are no cuts that would potentially damage services to folks living in their homes. Or we're really looking for some of those pieces next week, starting in the Senate Appropriations Committee.
Absolutely. And as somebody who is looking at doing an Ironman again this year, having done one in the past, I will tell you that's easier than sometimes sitting through all of that detail hearing, because those get to be long and very detailed, very important, but they're just long hearings and a lot of time spent. Looking forward to that as well. So with that, let's talk about what do we want folks to do next week. If they're listening and they want to weigh in specifically on the prescription drug bill, what do we want them to do next week, or with this weekend, I guess?
You've got plenty of time. We want you to email your senator, and we've made it super simple for you to email your senator. Go to aarp.org/ND advocacy, and you can click on that link and you can send an email directly to your senator. And again, let them know this is important to you. Maybe it's important to your parents or your other folks that you're caring for, but this is an important issue, and we want your senators to know that now's the time to take action.
Yeah, so there should be a banner right down here somewhere, aarp.org/ND advocacy. You can find all of our work during the legislature there and updates on the latest happenings and things of that nature. But you'll also find the link shortly to email your senator about Senate Bill 2031, which is the prescription drug price reference pilot project as well. Before we get out of here, I do want to make one more call. So I know the prescription drug bill is a huge, important issue, but we also are going to have AARP Day at the Capitol coming up in, I guess it would be 11 days from today, as part of it. On Tuesday, January 24th, it's going to be AARP North Dakota Advocacy Day at the Capitol. You've got a great agenda put together and lined up. I know I'm excited about seeing folks come in. We still have a few seats left on the buses. So we've got a bus that's coming on the eastern half of the state, Grand Forks, Fargo, Jamestown. So if you're in one of those areas and you'd like to come to the Capitol, we can get you a ride on the 23rd. We'll put you up in a hotel at our cost. It doesn't cost anything to you. Help you understand a little bit about what you're going to do. And then on Tuesday, take you to the Capitol, shepherd you through the Capitol, get to see the process, talk to your legislators about the issues that are important to you and older North Dakotans, and then get you on the bus and start you heading home late afternoon on Tuesday the 24th. We've done this a couple times in the past, had a blast. In addition, if you're in the Minot area or up in that area, we have a bus that will leave early Minot on Tuesday the 24th, excuse me, bring you down here, spend the day with us, and then take you back that afternoon on the 24th as well. So aarp.cvent.com/ndcapday. Anything you want to say about that?
No, I'm excited. It's
you have not done one of these.
I've not done one of these. This is my second session. Actually, today is my third anniversary.
You beat me to it. You stole my thunder.
But that was my job. So I've got red on. We want to see red up at the Capitol.
Yeah.
You know, I talk all the time when I testify and when I talk to legislators that this isn't about me. It's about what we hear from members. And so we are going to give you the opportunity to come and talk to your legislators, really demystify the process. I think oftentimes, you know, we talk in numbers and codes and, you know, but we want you to see that the legislature is very accessible. They want you to be involved in the process. They want you to ask them questions. They want to know what's on your mind. So this is a day that you can do that. You can learn about the process, be there to talk to your legislators and really help support, you know, the work that we do every day.
Absolutely. And I'm looking, you guys can't see it off screen, but there's a cardboard cutout of our founder, Dr. Ethel Percy-Andrus, and she talked about the Army of Volunteers, and that's how we get the work done that we do at AARP. And so we're looking forward to seeing that Army of Volunteers here in North Dakota on Tuesday, January 24th. If you've ever just wondered, what's the legislative session look like? What does that process look like? Or you've never experienced it, you've never been to the state capitol, encourage you to register. Come join us that day. Again, if you need a ride from Grand Forks, Fargo, Jamestown, we've got stops and a bus that'll do that on the 23rd. Get you here. We'll put you up in a hotel, walk you through the day on the 24th, and get you back to those locations on the 24th, and then in Minot on the 24th as well. Get you here in the morning and get you back early in the evening there as well. So excited to see you. With that, I would just want to say this is Janelle's 3rd year anniversary. You heard her steal the thunder for it. Super grateful to Janelle. I'm super grateful to all of my team. Marnie's behind the camera. Maybe someday we'll get to hear from Marnie on one of these as well. But also, I don't want to leave out Doreen and Wendy, who oftentimes are helping pull things together behind the scenes when we're up at the Capitol and organize all of the other great work that we do as well as part of that. And so, again, hope you join us for AARP ND Advocacy Day at the Capitol. If you're free on Monday the 16th, come join us. At a minimum, go send a note to your senator, ask them to support Senate Bill 2031. And with that, this has been another All Things Advocacy.